today. Again, I'm glad to welcome back Floyd Heater, President of Warren Memorial Hospital and Valley Health Vice President. And he's joined today by Jenny Grooms from Valley Health Foundations. And they are going to be giving us an update on the new hospital. Both of them, if I remember correctly, are Rotarians. I know Floyd's a member of the Front Royal Club. And Jenny, I believe you're at the Winchester Club now. Is that correct?
Coming back, yes.
Yes. Okay. So bear with us while we are handling the, bear with me while we're handling the technical end, because I'm going to be advancing their slides for them. So let me get that teed up while they are starting to speak.
And Melanie, I've got the recording on.
Yes, ma'am. Thank you. All right. Floyd and Jenny, it's all yours.
Looks like you got it all teed up there, Melanie. Thank you.
You bet.
Well, good morning, everyone. It has been, I was there in person the last time we talked and went through a little PowerPoint. And I would just want to thank you for allowing me and Jenny to come, inviting us to your meeting to share a little bit about the new hospital. Things are getting very interesting now. We are 2 months, just about 2 months away from opening up our your new hospital. The community's, this is going to be a gem for our community. I'm going to be very proud of it. I have increasingly been getting out to the site, taking folks through. Just had our system CEO, Mark Nance, through last week, and a few other leaders from Valley Health. Actually, Joe Silik, chairman of the board, and he had not seen it in a while. So it was a real eye opener for, if you haven't, you can miss a few weeks and it changes. The site and the inside, particularly of the hospital, really have changed at a rapid pace. So it's all hands on deck between now and the middle of June. We'll get into the calendar of things here in a little bit. But anyway, thanks so much for letting us spend a few minutes with you. And we really have some exciting things to relay. Some of this will be, we'll come back to you when we talk about the, if you go to the second page there. Oh, wait, stay that for a second. That view, well, never mind. That view, the pictures really don't do it justice. I know that is a beautiful shot, and you'll see some other ones inside the building, but that, even on a clearer day than that, how far you can see. And I was up there last fall, and of course, when that fall color comes in, it's just wonderful. It's a beautiful site. So we'll talk more about our the opening dates and stuff like that here in just a little bit. So okay, Melanie, sorry.
No worries, no worries.
All right, you may recall this. We've updated this slide a little bit, just to kind of frame it big picture. Statistically, you have it's 177,000 square feet, all private rooms. I cannot emphasize that enough. We have, and people ask, just to for you to recall, Warren is a 60-bed licensed facility. We're moving to 36 private bed. People ask me, why are you getting smaller? The fact of the matter is, our census has been running for the last 15 years or so, somewhere between 20 and 30 patients. And we're anticipating at an average daily census of around 27, 28. So that those additional beds on the inpatient side give you that buffer you need for operating efficiency. So we have not used those 60 beds in many, many years, at least a couple decades. So that's just kind of a common question I get. So if you get that, you'll be able to answer that from communities and from other citizens. The emergency department, you'll get a picture of that here in a couple minutes, is going from 12 treatment areas to 18. The footprint is at least 50%, I guess probably 35% bigger than the current one, if not more. And our nurses are going to, a couple of them were joking with me the other day that we're going to need roller skates for them compared to their current environment. It's really just a lot of additional space. In that unit will be a 5-bed clinical decision unit, which you might hear referred to as observation beds. That's to put someone in an observation status until an admission or discharge decision is made by the, in this case, the emergency room physicians will be overseeing that clinical 5-bed unit. 3 ORs, 2 endoscopy rooms. cardiac cath lab will be moving over. That's actually going to take about 6 weeks. So we'll start moving that out in May and getting that set up in the new hospital. And of course, Jenny's going to talk a little bit about an event we are an exciting part of the campus development that we really initially didn't anticipate. And it really it's a difference maker in terms of the whole medical campus and the approach we're able to take. And Jenny's going to talk about that more later. I should mention that during the course of the last couple of years, our original hospital application had a request to the state for a fixed site MRI and a second CT scanner. They originally denied that. And we went back to the well a couple times while the hospital was being constructed. And here just last year, late last year, they did indeed approve a fixed site MRI. So we won't have to use a mobile unit, and which is virtually there full time anyway. And then we'll have a second CT scanner because our first one is occupied most of the time by emergency department patients. So this will be a real patient satisfier for sure. We're about 95% complete, and that's as of a couple days ago. So that's, as you say, we're zeroing in. Next slide, please, Melanie. I won't read all this to you, and feel free to, Melanie, anybody wants a copy of this, I don't see any harm at all in sharing that information. If you want to print it out or share it with the other members of the club, that's fine. And you can see that most of our all the major milestones have been hit here. The last bullet on that page is not an insignificant one. Melanie knows this
Yes.
as well as anybody. But right now, the current status is, and probably most of you know this, I would imagine, but when the helicopter has to land, we literally have to summon people to move their cars so that we can clear the helipad. The landing is right in the middle of the parking lot. So that will no longer be the case. And believe me, that's a huge issue for both for the air service folks as well as our employees. So I thought I'd mention that. Go ahead. Again, interior, the paint, wall covering, all the fixtures. We got internet in now. I can't do anything without that these days. Got our temporary certificate of occupancy, and here next month we'll have our life safety inspectors coming through. So those kinds of things are ahead of us. Go ahead there, Melanie. So that is not a rendering, but that's an actual picture of our emergency department. It's a nurse's station in our emergency department. And that is that general coloring is it's not exactly that way on every unit, but throughout the hospital, there's the soft earth tone type of colors, very relaxing. A lot of natural light comes into the facility. You really can't see that here. You definitely can up on this. This is on the first floor, ground floor, if you will. But anywhere we had an opportunity to bring in natural light into our environment, we attempted to do that. Just a totally different physical look to it. Our patients will notice it immediately, and so will the families when they walk in the door. And that is that OR is the envy of all surgeons in Valley Health right now. If you, that is, I think they are just slightly larger than the ones in Winchester. I don't want to misspeak on that, but I think one of the doctors was telling me the other day that they were slightly larger. But our doctors and our surgical staff have already been out there looking at how the workflows will work. And they are just so excited. They cannot wait to get into their new environment. And they are considerably larger, but I think those are around 700 square. Each room is around 700 square feet or so. Brand new equipment, lighting. So our new orthopedic surgeons and our new general surgeons, really vascular surgeons, are ready to go. So. Okay, Melanie. And just a few interior milestones there. Again, I won't take the time to read them all to you. There is some interesting stonework, really nice, not everywhere, but strategically placed. And I think it makes it a more warm and earthy touch, a relaxing feel. So I like the way when I was up there the other day, I noticed the way they've placed the stonework in certain areas is just really, really an excellent touch, very nicely done. So here's the calendar as it stands today, and I don't anticipate any of this to change at all. We are too close for it to change, really. It'd have to be something major. So the hospital departments, and again, a lot of the leaders and their staff are already out there checking out their environments. We have, as always happens with construction, you have requests for, oh, can you put an outlet here? Can you put something there? Little punch list items. But for the most part, their workflows is what they're really looking at now, and making sure patient safety is number one goal. The patient move, the actual move date, and we'll kind of cut over, if you will, to the new emergency department and the operation of the new hospital will be on June 23rd. And following that, I didn't talk about this earlier, but on the right side of the campus, as you're looking towards Leech Run Parkway, you have the hospital proper on the left, and on the right is a medical building of basically equivalent size. And on the third floor of that in that building will be all our physician practices from the community. On the ground floor, there'll be hospital support departments like laboratory, materials management, pharmacy, some of those. On the second floor of the medical building, there'll be the practices you see listed there. Front Royal Family Practice, because they're so big and our largest primary care provider in the community, they'll essentially occupy the entire third floor, with the exception of a small part of it, which will be some of the administrative offices where I and a few others will be. So that, so this move of Front Royal Family Practice be about a week or 10 days, not even the following week. And then the specialty clinics will move over in July. So I am going to stop there because we have some really, Jenny is, thank you for being with me this morning, Jenny. She has, and her predecessor, Nikki Wilson, and I and Jenny had worked very closely on a capital campaign really since, what's it been, 3 years ago now, Jenny, we started?
Yeah, 2018.
And as I mentioned early on, this started out as a hospital project. Our vision, our desire was for it to always be more of a wellness destination. And as over the years, as we pursued not just taking care of the acute care needs of our community, but how we can, with 150 acres there, how we can make it more of a community destination for other things. And lo and behold, early in the campaign, a very gracious and generous community partner came along early in the campaign to really basically help us early on in our journey, make it a wellness destination. I'll let Jenny talk about that more because we're so excited about it.
I'll spend one slide on the campaign, but there are 3 on that gift. And thank you again for the invitation, and definitely certainly giving credit to Nikki Wilson and the hard work of the community and the campaign committee. So in 2018, Nikki pulled together, it was actually Joe Silik and General Hopgood to co-chair really this outreach to the community. And what the Warren Memorial Hospital Foundation does, we're not building out the emergency department, but what it expands the mission. And as Floyd said, really trying to help this be a wellness campus. People don't come see us because they feel good. And we want them to be a little more involved in their health. And so there's a couple things I just wanted to highlight that individuals' gifts, and over 140 people have supported this campaign, and we're still going because there's just so much more you can do thanks to that support. That number's actually old. We're over 2.5 million at this time. And as Floyd said, getting ready to open. So we'll talk very briefly about the trail following this, but I wanted to highlight a couple things in addition to the trail system. One would be a history wall and medical history display, which is unique to Warren Memorial, and thanks to philanthropy and a very generous gift from Dr. Tom Pattison. You will have in the main hallway, where, as Floyd was saying, the hospital's on the left, the medical office building's on the right. For better or worse, people spend time at the hospital. And if you're not a patient, how do you engage them or just create interest or education around that? And these cases will hold an incredible medical museum of his collections over the years. Dr. Sherman's original medical bag, just all these points in time that will hopefully bring up fond memories and hopefully a sense of pride of how far your hospital's come since 1951. Also added, Warren Memorial will be the first hospital in all of Valley Health System that is going to have something called My Chart Bedside. If you've had an experience at Valley Health, you may have heard of My Chart. You've got to log in. I can see my lab results. Some of these things, what My Chart Bedside is it gives the patient, if you're an inpatient at Warren Memorial, more control at the bedside. You can, from whether it's a tablet that we give to you, or even from your phone, you can access the menus. You can see pictures of who's the staff that's caring for me today. You can make your own notes, look at the notes in the medical record, and just again, a more personalized experience in these very private rooms. Very excited, Floyd, of how far this has come. And another thing a campaign does is allow the community to just be a part of this as a permanent piece of history at this exciting time that we're changing. We are still doing our paver campaign. There's going to be an amazing patio outside of the cafeteria, which is actually on the ground floor that overlooks Leech Run Parkway. So it'll be outside in between the hospital and the medical office building, where people can purchase, and 100% goes back towards these enhancements we're doing to the hospital as a way to honor or memorialize, or just put your favorite quote while someone's out there having lunch, waiting on their friend to have a procedure. So that is still going. Next slide. So the trails. Fred and Christine Andrea came with this amazing idea. And again, what philanthropy does is it helps us expand the scope. It wasn't something you would expect a hospital to do. They're buying medical equipment and talking about the bricks and mortar and those pieces of what they need to do as an acute care hospital. The Andrews actually have a walking trail on their property, and they spoke about a very impactful experience while their son was having surgery up north. They were at the hospital for a better part of 6 to 8 hours. And what do? Sit in a waiting room. This location had a walking trail that you could disconnect from the sterile environment, that you could reconnect with nature, and really pass the time just a little more effectively and meaningfully over the course of this. So 100% through their gift, they would have the Andrea Family and Wellness Recreation Trail. It's over 2.5 miles. It has lots of switchbacks. If you've seen this location, it is literally cut into the side of a mountain. Folks of any age can do it. It really is. We worked with a professional trail contractor that kept the grade 8% or less. So hikers of all abilities. So envision whether it's a physician that's taking a break, in less than 10 minutes, they can be out to a rest area in the woods on a bench, really trying to empower their resilience and reconnect with their mission. Whether it's patients that are working with physical therapy and talking about going from hard surfaces to soft surfaces and transferring, so using in therapy, and certainly the guests, people there with their family members can certainly spend time. And the system includes a couple footbridges, a couple rest areas. Looking at it from the ground up, you have no idea how far it goes to the top of the mountain. The upper overlook at the very top is just over a mile from the entrance. Next slide, Melanie. I think it shows sort of the route. So if you see there Leech Run Parkway, down there to the bottom right, and then looking up the hill to the hospital, what you see from the hospital parking lot is a rock wall, which is the lower overlook. And we're working on the signage now. To Floyd's point, on a clear day, it'll show you a map. You can see 22 miles away to the Allegheny Mountain Range. You can see Stevens City, 12 miles up to the north. You can definitely make out the old Warren Memorial Hospital, the dome of Randolph-Macon Academy, Signal Knob. It really is just some of the best views in the valley that hopefully you've had a wellness journey going up there, but also just takes you away maybe if there's something stressing and going on in your healthcare journey. And then those switchbacks continue up to an upper overlook towards the top of the mountain. And down to the bottom left, eventually we hope there will be a connector. It really comes out there to the track at Warren County Middle School. So really seeing this as a community partnership. It is dusk till dawn. It is foot traffic only. We don't have mountain bikes and stuff here, but we hope that people will use this trail. And again, partner with your hospital in your wellness journey, that this really should be accessible to all. Next slide. And this is a digital overview and almost the view that you saw from Floyd's picture on the opening slide. And we will have the actual photos. Well, certainly the trails will be completed by the end of May. So when we open in June, you'll be able to come walk the trails. And again, best views in the valley, and hopefully give people that moment of pause. And thanks to the Andrea's gift for helping us achieve this journey. And that is where we are with fundraising. Back to you, Floyd.
Okay, thank you, Jenny. So it was one of the some of the new areas of focus that we're really working on have been, as you may have heard me talk the last time we got together, we've really put a lot of emphasis on developing, increasing our primary care base, new family physicians, internists to the community at Commerce Street. Front Royal's brought a few on over that time as well. But also in the area of orthopedics, we've been able to bring on Dr. Eric Mitchell, who's a fellowship trained sports medicine doctor out of the University of Massachusetts. Eric joined us about 2.5, 3 years ago. And most recently, Dr. Mesfin Shabashi, who's a fellowship trained total joint surgeon as well. And they are getting, their reviews have been just excellent. Everybody I've talked to, and I've received lots of unsolicited positive comments about both of them. Consequently, as we built the plans for the new hospital, orthopedics was an area certainly locally of unmet need. And I think those two, in addition to Dr. Wynn, Dr. Audie Wynn, who's been on our medical staff for a number of years, has really both clinically and programmatically been helping us lead the development of that program. And we have applied for a Center of Excellence designation, which we hope to receive by this fall. So orthopedic will be a big part of it, as well as, part and parcel with that is a physical therapy and sports performance institute or center, which will be on campus as well. So we'll have several physical therapy locations in the community. This one at the new hospital will be largely focused on sports medicine, but we'll still have Riverton Commons, Commerce Street, and et cetera. And cardiology and vascular surgery, you heard me mention that the cath lab will be moving over into the new hospital, obviously. And then over time, and we have been increasing our community coverage for cardiology. Right now, we're 5 days a week. And we, on weekends, we are not there yet, but over time, as the volume grows and the response to the program increases, which it has been considerably, we will, our ultimate goal is to try to get to 24/7 community coverage for heart and vascular. Next slide, please. I just mentioned, I kind of got ahead of myself there on the Center of Excellence designation, but we have applied for that. We've asked them for a ready date of mid-September. I think September 15th is approximately when we expect them to come through and look at our program. So, and I mentioned physical therapy as well. And we actually are, for that particular unit, that sports medicine unit, I just signed off on the additional staff yesterday. So we're hiring about 5 additional employees to dedicate to that. And just met with the vascular surgeons the other day, and we are actually increasing their clinic coverage now in the community by 2 days per month. And they will, now that they have recruited an additional surgeon to their group that allow them to staff their Winchester clinic, and also allows them to increase the time that we'll have them available in Front Royal and Warren County, and they'll begin doing more procedures at the new hospital when it opens. think we're getting, are we there?
We're
I
there.
think, so I believe we're okay on time. Hopefully that did not, I guess it took about 20 minutes, 25 minutes or so. So thank you for indulging us. That is the state of affairs right now. Your new hospital is about ready to open up here in another 60 days or so. And it's been a great journey. When I think about the last, I guess, 5 years, we actually took it to the board or so about that time, and about 5 years ago, for their blessing and their approval. And it's been quite a journey since then, but very excited. And our employees, it's funny, you talk about it so much from the time it's approved to and as you work your way through it and you break ground and construction milestones are met, and it almost becomes part of your regular agenda and talking with employees or your meeting. And ultimately, when you're 2 months away, I can just see the additional lilt in everybody's step, the smiles on the faces, the energy levels it's nice to see, because as you're working through it, and it is a lot of work, it becomes kind of rote, and like I said, a standing agenda item as you're describing the progress of it. Now they're getting out to see it, and it's just a totally different dimension. You can really see the vibe, if you will. It's an amazing experience to watch employees' eyes light up. They compare their current home to what their new home's going to be like. So, and you as well as citizens, as Rotarians, will be very proud of this new hospital, I promise.
Thank you, Floyd and Jenny. I see you've got your hand raised. Hopefully we've got some time for some questions. Sienna, I saw yours first.
All right, a couple of questions. I cannot imagine how excited you guys are. Having watched this come along from the Planning Commission side to now, this is really something. So 2 questions. One, how much of the hiking trail is going to be wheelchair accessible? And number 2, can you show us that overall map and show us the traffic flow? Because I have to admit, I went up there and drove around a little bit, like probably most people in Front Royal. And there's this one really narrow drive on the north side. I was trying to figure out how it all works and how it works fast.
Floyd, I'll speak just a second on the trails and wheelchair accessibility. So the entire trail is what we call natural surface. There's no paving, there's no gravel. There's a little gravel at the front of the entrance to worry about erosion. So I would have to get more information on what exactly that definition is. It is certainly wide enough, but what is considered where you're rolling wheelchairs, I would perceive that it is all the same width until you get up to the top. There's some rocky areas, but to the first rest area that you saw on the map, it is fairly level, fairly straight with footbridges to go through. So I would imagine at least that portion. It's a good feedback that we could maybe promote a little more and get some better definition around.
And Cian, what was the second part of your question?
Can you talk to us a little bit about what the traffic pattern's like? Because I noticed like the north driveway is very narrow, and I was trying to understand the speedy emergency access and the regular traffic and stuff.
Yeah, there's two entrances to the site. There'll be one main entrance for the public that we're encouraging, which is down by it'll be the southern entrance down by the emergency, where you come into the emergency department. The other one is really a service entrance, and we'll have that properly signed, and it'll be clearer when we go to open the new hospital. But there's really one main entrance for the public to the hospital, and that'll be the southernmost entrance.
Thank you.
Mm-hmm.
Michael, your hand is raised.
Yeah, it was mainly for one of Floyd's employees who finally woke up. What is the intent? I'm curious too, because they're my neighbors. What are the intentions for the current building over at where the hospital currently is?
the second most popular question. The first one I addressed you is, when is the new hospital going to open? The second is, what are you going to do with the old campus? And I won't get into too long-winded of a thing, because we're actually working on it. We're working with a consultant right now. We originally had gone down a fairly narrow path of, with Lincare staying there, our thought was around assisted living, maybe independent living, but in that senior care continuum of care mode, if you will. We kind of took a step back about 6 months ago and said, let's look at some broader community engagement. This could be more than senior care focused. It could be a number of things. So we are actually, some of you, maybe even at this meeting here, we're doing some external interviews. We've done about 40 or 50 internal interviews with a consultant by the name of Dynamis. Scott Keller is doing those. And now we've probably done 25, 30 in the community. We're looking at all kinds of things, but I certainly know with Lincare staying that senior care will be definitely an element of this. There's no doubt about that. We are looking at workforce development. Well, first of all, training up more people to care for what is a growing elderly community, and also being just more of a center of training healthcare professionals and teachers. Some of the social determinants we're looking at: affordable housing. What could we do in the way of behavioral health? And I think you would all agree, we haven't got that figured out. Nobody has, not too many people in the country have, in terms of, but we know we're not really stepping up the way we could in addressing the behavioral health issues that show up at our doorstep in the emergency department every day. So that's more long-winded than I intended, but I wanted you to know that the focus is becoming a bit broader. And I actually think what goes into that, what's soon to be the old campus, could be very dynamic and very helpful for the community, and more than just senior care, potentially. Is that?
Well, let me ask your employee. By the way, just as a follow-up, Sherry and I just for Jenny, Sherry and I just purchased a gift in a brick in honor of General Hobgood.
Awesome.
I was the first person Mac Hobgood hired when he came to RMA, and he's a very dear man to me.
Thank you. Thank you so much.
Well, Mac's one of my favorites, and he really is, and he's just great to work with.
I'm very partial.
Thank you. Are there other questions? Anyone else have a question? Now is a good time when they're right here with us today.
Melanie,
Yes, ma'am.
this gets a little bit away from the brick and mortar part of the presentation. Are they still pursuing with Anthem, Blue Cross and Blue Shield to be a more active, viable partner with health insurance care for the people? I know it was a very sticky point last year for a lot of the companies and individuals in the community. Are they trying to work with you better?
That was a difficult period of time, and you're right, it created some stress on our business community, and but we, really, and I know that was probably the last thing on Mark Nance's list that he wanted to confront on his first days on the job. But we did the right thing. We really needed to seek payment levels that allowed us to pay our employees well, give them, increases. I know that, really that was the fight, was really to try to make sure that we had adequate enough payment levels to afford new equipment, to afford to provide the community what they deserve. So, and it largely rested around that. And we got there. And as more specific to your question, yes, I think the day is where hospitals, health systems are going to have to, and Anthem knows this, and we know this, we really are going to have to partner, if you will, to use your word, more, genuinely to really care for our population. You'll hear this term thrown around, population health, and those terms. What that means is it really means insurers, businesses, health systems stepping up to the plate to really address some of these things I just talked about, which are, behavioral health and some of the social determinants to cause healthcare utilization to get out of control. And so it's really working together. And I think Anthem, they've demonstrated their ability to do that. And so I'm optimistic about it. But we're going to work with other payers too, including our own. So the best one at partnering on that is what we're interested in. But Anthem's huge, and we certainly want to.
A big, beautiful facility that we're getting. We don't want our people to be going out of our service area using their facilities.
Exactly. Yeah, that's exactly right.
Thank you so much.
Uh-huh.
Kathy, I see your hands raised.
Yes, thank you. Thank you, Floyd and Jenny, for being with us today in this great presentation. I was on the board when we approved to buy the land for the new hospital. So for me, it's great to see it, and I really appreciate that. I do have one question, though. I know it's been kind of a sore subject for the community, and that's on maternity services. I know that that's not being offered at the new hospital currently, but are there plans that could be added later?
You get that? That's probably the third most common question, Kathy. But and I think absolutely will consider it. It's not off the table. It is not part, as you know, of the current plan. But as community changes and evolves, yes, and the hospital does have expansion capability. It can go up vertical. It can go up vertically. Of course, we have a lot of acres that we can continue to expand on too. We have about 75, 80 developable acres. So we can expand horizontally or vertically. And so we have not taken it off the table. I know some people early on thought we had, permanently, but it is something we will definitely consider. Our community is going to change a lot the next few years. And as it does, other partners we just talked about might want to come along and help us reintroduce that service. So we're not ever taking that off the table. We know it's important.
Great, thank you.
Kathy, I'll just add, my first day on the job was with Warren Memorial Hospital Foundation. I was their first development director, and my first day was driving out to the newly purchased property that the Valley Health Board had just approved. So I've seen it from both ends as well, and excited.
Yeah, it's got to be kind of
great.
For you, Kathy.
Great opportunity.
Oh, can I just, someone in the chat box, I just checked it, asked what an FTE is, and thank you. It's a full-time equivalent employee. So I don't know who that was. I couldn't read it, but that question came up and I just thought I'd address that. It was Rob, right? Okay.
And for those of us who work in healthcare, it sailed right past me. I didn't even notice that was something we probably ought to explain to people. So thank you for asking that question, Rob. We're bad about that. Any other questions? Well, again, Jenny and Floyd, thank you both so much for coming back to talk with us again, give us a new update. It is very exciting. As somebody who's been in this community now for 30 years and started my Valley Health career at Warren Memorial in the basement, this is a really, really exciting time. So it's great to hear the latest. And as I've told a couple of club members, because I don't work quite as directly with Warren Memorial anymore in the marketing communications role as I did at one time, a lot of this is new information for me too. So this was very exciting to have you both come back and share with us today. So thank you.
Kathy, I can top you on that one. My connection with Valley Health, I was born there in 51.
Yeah.
Oh.
I wasn't going to bring that up, Debbie. I didn't want to allude to anybody's age. We've already had that happen once.
June brought hers in. I'm proud of every one of mine.
Well,
thank you. Now,
I just wanted to
sorry.
I wanted to thank you again, Mel, for the opportunity to be here.
Now, you may recall that we do not give our speakers gifts. What we do instead is we donate a book to a local daycare or preschool in your honor. So Barbara Ecton is showing this week's book, which is There Are No Bears in This Bakery, written and illustrated by Julia Sarcone Roach, and it will be presented in your honor to the Gear Preschool. So thank you again for joining us today. And Michael got our mascot, Rubber Chicken. Thank you very much, Michael. Kathy, I was remiss in going right past this on my agenda earlier. Do we have any announcements from the area or district level that need to be made other than what's gone out via P-mail here the last few days? I don't want to leave that out if there's something we need to talk about.
Just a reminder, PTT sessions are back on every Thursday. We took a break last week because we had the pets training, but this Thursday it'll be club secretary training. Really important training for anybody who is a club secretary or who is considering to be a club secretary. Even if you're not considering a secretary, it's good to understand what information has to be recorded and saved for each one of the clubs and entered into our databases. So it starts at 4:30 this Thursday. Nancy Rudolph, who is from the Strasbourg Club, is going to be doing the training. She's been club secretary for her club for over 20 years. Ooh. So she's got tremendous experience. Wow. It'll be a great training. Please join us for that. The week after that, it'll be club treasurer training. And then there's more in the schedule as well too. So that's great. We had a good attendance at Pets. So we had Mary Jo and Peggy and Barbara from our club attending, which is great to see everybody there. Good turnout there. So appreciate that as well too.
Debbie, yes, ma'am.
Just a reminder that Mother's Day is right around the corner. If anyone wants to participate in the cards for the local nursing homes, think about placing your order and let you know who's going to do the different facilities.
Thank you. After you emailed me about that, I forgot to write it down. And when I don't write it down, this is what happens. So thank you. Yes, as we've continued our project this year to send greeting cards to the area nursing homes, Mother's Day is right upon us. So if anybody is willing to do that for this particular upcoming holiday, I guess one thing I know Debbie had mentioned that they had checked with Lynn Care about the number to use for Mother's Day. We might need to adjust our numbers a little bit for the various nursing homes just to reflect the mothers in the group or the women who have been like mothers. Anyway, if you're interested, please let me know, and more to come on that. So thank you. All right, our program next week will be on the proposed Shenandoah Valley Rail Trail project that's been in the works for a while down the valley a little bit, but now they're looking at the feasibility of having it go from Broadway, Virginia to Front Royal. So we'll have Dr. Ellis Johns, who's involved with that project on the Warren County side, who will be speaking with us next week about that project. So more to come on that next week. Rob, do we have our magic Hal doing his thing for the Spirit Award for this week?
Okay, let me shuffle the tickets here. Shuffle. Okay, and the winner is Cian Davis. Look at that.
Yeah, congratulations. And thanks as always to the Napiers for their sponsorship of the Spirit Award. And and just again, as I've mentioned a couple of times, I'm planning to look at an opportunity for some sort of an outdoor event, hopefully at Linden Park. Just haven't scheduled it yet, but in a little bit warmer weather, whether it's at our regular meeting time or a weekend afternoon, to be determined. But we talked about the possibility of maybe doing the Spirit Award there since we haven't gotten together for so long. More to come on the plans for outdoors. I was trying to wait till the mornings were a little bit warmer. Any other announcements before we do the four-way test?
Hey, Melanie?
Yes.
I just want to thank Kathy for approving the purchase of that land.
I think it
was a wonderful vote.
Better late than never, right, Kathy?
Absolutely.
No, George has an event coming up in a minute here, doesn't he?
Yes, you do, don't you, George? The foundation event, that's on the 24th, correct?
24th of April. Yeah.
Yes.
Yep. I hope you guys will join. You should have, I think I've seen 2 invitations go
Yes.
out.
Yes, 2 have gone out from the district. And just also a quick reminder before we do the 4-way test, the 24th is also the date of the Empty Bowl Supper fundraiser. So got lots going on in the month of April. So plenty to keep us all busy in April and May. All right, if you would please, before we adjourn, please join me in the 4-way test. Of the things we
things we
think,
think,
say, or
say,
do.
or do.
Say or do.
First,
First
is
is
it
the
the truth?
truth.
Is it the truth?
Second,
Second
Is it
fair
fair to all
to
concerned?
Concern.
third,
Third,
build
Build
goodwill.
and better friendships.
Friendship.
And fourth,
Fourth
will be beneficial to all.
All
Concern.
concerned.
Thank you all. Have a great rest of your week. And we are adjourned.
Hey, Gail,